Hello, we're answering questions on sexual health. I'm joined by Dr. Catherine Hood. Hello, Catherine.
Hello.
Got a question here from an 18-year-old who wants to know something I'm sure lots of 18-year-olds actually want to know. Currently in a relationship with their first sexual partner. Recently, she said she would like me to perform oral sex on her, but is it possible to catch an STI, which of course is a sexually transmitted infection, from oral sex? And if so, what can I do to prevent this? I think this is a big concern for young people, isn't it? They're all thinking about herpes and things like that.
Exactly. And also, a lot of young people now engage in much more oral sex than perhaps we did when we were teenagers. So it is a concern. And the answer is yes, you can pick up sexually transmitted infections through oral sex, and there's a variety of them you can get. The first one, as you mentioned, is herpes. Now, herpes is caused by the virus herpes simplex virus. Now, that's the virus that causes cold sores. So not only is it possible to actually pick up the virus from someone's genital area, they've got a genital infection, but it's also possible to pass it on through oral sex to her. Okay, so that's one that can pass either way.
So a big no-no is if you've got cold sores, which everybody can see, just refrain from oral sex until they're completely cleared up.
Absolutely, until it's completely gone. So that's one thing to say. Now, there are other infections as well to be concerned about with oral sex. Chlamydia and gonorrhea can both be spread through oral sex. So if your partner has any symptoms or you're worried, I mean, this is her first partner, it depends what her sexual history was before. If she's likely to have any infections, it's worth getting a checkup and just make sure she hasn't got anything.
I can imagine that a young 18-year-old boy wants big signs. What can I do to prevent this? Are there any clear signs, apart from the obvious sort of cold sore thing? What are the other signs?
Well, if she's feeling discomfort or there's increased discharge, but also you have to remember she may not have any signs, nothing at all.
Hopefully not.
Now, in terms of protecting yourself, you can use a thing called a dental dam. Now, a lot of people don't like using these. This is it's a thin sheet of latex, a bit like the latex you get in a condom. And you can use this you can spread this across the vulval area, and it acts as a barrier between your mouth and their genital area. So, it stops any catching sexually transmitted infections.
I can't imagine those being particularly popular or easy to get hold of.
They're very easy to get hold of.
Are they in the chemist along with condoms?
Yeah, you can get them in the chemist, absolutely. But yeah, a lot of people don't like using them, I have to say. So probably going and just making sure you're both clean, having a nice checkup is probably the easiest thing to do. Then you can.
And if you're worried that you've got anything, get yourself checked out. And I mean, these things aren't fatal, are they? I mean, sexual diseases can be, but the ones that we're talking about are easily cleared up with antibiotics.
These are not fatal, but there is one other thing to say, that particularly for women with oral sex, not so much for him, but that we are increasingly seeing oral cancers in younger people, and we think that might well be linked to transmission of a sexually transmitted infection called the human papillomavirus. And so by having a lot of oral sex with lots of different partners, you might be putting yourself at an increased risk of oral cancers.
So that's one thing where you really do need to get yourself checked out.
You do, definitely. If there's any soreness in your mouth, ulcers in your mouth that don't heal, go and see your doctor.
Catherine, brilliant advice. Thank you very much indeed. Well, if you have a similar problem, we hope we might have given you some help. But remember, it's always best to go and see your own doctor for medical advice. Thanks for watching. We'll be back with more health questions and answers.